Will this 25-year-old kid turn out to be a good hair transplant candidate? Stick around to find out. Hey everyone, welcome to the Hair Transplant channel. My name is Joe Tillman, and this is the official YouTube channel for hairtransplantmentor.com. And if you don't know what a hair transplant mentor is, just head on over to read all about it. Right, so like the intro said, 25-year-old male that has reached out to me looking for my opinion on his candidacy for hair transplant surgery. But before we get into that, a couple things I gotta talk about. First thing is, hey, I got a contest. I'm trying to reach 20,000 subscribers. Dr. Yazdan of Modena Hair Institute wants more exposure for Grow MD shampoo, and you guys like winning stuff, so it's a triple win. All you gotta do to enter the contest is make a comment down below, but you gotta be subscribed, so don't forget to subscribe first, and of course like the video while you're at it, like you might as well. Second thing to mention is I just released hair transplant class number 23. You can check it out right here. Just click on the card and go check that out, where I'm talking about the top three, the only three, things that you can do to deal with an FUT donor scar from strip surgery. No one's talking about it except me. Check it out. There is a third thing I need to mention real quick, and that is very simple. I'm not a doctor. I never have been a doctor. Probably won't ever be a doctor. So don't confuse what I'm going to be saying in this consultation as being actual medical advice. My experience comes from being 20 years in the industry, working in hair transplant clinics at a very high level, some very well-respected clinics. And I've met and evaluated tens of thousands of patients throughout my career, but I'm not a doctor. So if you want actual medical advice, go seek out a doctor and see what they have to say. Okay, let's do this. So I may or may not have mentioned before that the latest consultation request comes from a 25-year-old male, and let me just get into some of his details here. 25 years old, and run through his photos real quick. Bam, 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 bam. And this is what he has to say. I started losing my hair at age 20. After 2 years of almost daily shaving, I realized that my balding pattern was still visible after a razor close head shave, which was making me look as a balding shaved guy, which to me looks like a loser, especially when you're young. Stop. Not true. Like, it may be your opinion, but there are a lot of guys that are doing just fine as head shavers. And like, look at my friend Harry over at Bald Cafe. Like, he's got a great channel and a great message for guys that don't want to have to deal with their hair loss and fight it all the time. It can be, like, you're young, dude. You're 25, and I'm telling you that fighting hair loss for the rest of your life can be, for a lot of people, a really exhausting endeavor. So don't discount it. Like, it can look good on guys, and a lot of ladies like it too, so just don't discount that. I don't think it's fair. I hate the shadow of my remaining hair, and I cannot live with it. I need to be either 100% clean bald, as if I had alopecia totalis, or have a full head of hair. But the balding look, or even shaved balding look, is not an option. I got on medical treatment with finasteride, dutasteride, and minoxidil. They did stabilize my hair loss completely and even thickened up a little bit of the existing hairs, but not nearly enough to get decent coverage to hide my bald spots. Fair enough. I would like more coverage. So I asked, and he mentioned some clinics here, and he was recommended to have 2,200 grafts to 2,500 grafts for the front, and between 1,500 and 1,800 grafts for the vertex. He says, if we assume I need 50 grafts per square centimeter to achieve decent density. I would like two things, please. A second opinion on what the clinic told me, and do I really need that many grafts? And then he wants my opinion on some doctors, which I won't go into here. He's been using the medication for 2 years. Oral finasteride, 1.25 milligrams of Proscar once per day. Oral dutasteride, 0.5 mg Avodart once per week because of its long-lasting 5-week half-life, and topical minoxidil 5% once daily as opposed to oral. He says his hair loss has stabilized and he has had some thickening. So looking into this, I think that before we talk about what is necessary and what's reasonable for your case, I need to be really clear here. You said in no uncertain terms, that you want either A, to have a completely shaved head and no semblance of a shadow, like you don't want there to be any stubble, or the complete opposite, where you want a full head of hair. Well, you can't get the full alopecia totalis or universalis look without having each hair, zapped out with laser or electrolysis, but you also can't get a full head of hair. So I'm afraid that if you go forward with surgery, you might not be happy with it, regardless of which clinic you go to or how many grafts you have, because you don't have enough hair in your donor region to give you a full head of hair on top. So that needs to be perfectly clear moving forward. But with that out of the way, let's have a look at your case. So as we're looking at this first image, he's obviously using his phone and then a reflection from the mirror behind him. But one thing to notice is that his hairline looks like it's still pretty strong, like most of his original hairline as far as the shape and the height. But when we look at the overhead here behind, you can see that there's kind of like this area of thinning behind, which means that the very center of his frontal hairline is becoming isolated and it's turning into an isolated frontal forelock. So that hopefully has improved, like it was worse before. Hopefully it's improved for the medication. And then as we move to the next image, the hair is a little bit longer, but it's more of the same. But this shot here is the one that really brings your case into focus for me. And this is something, it's fairly common, so it's not like it's a rare situation. But I got two words for you: retrograde alopecia. And what this means is that you are thinning above your ears and from your temple points backward. And you can see this line along the side of your scalp where the density drops significantly. You've got higher density on the top and then lower density on the bottom. And it goes all the way up down this entire side and behind your ear. And what this means is that you have a reduced viable or a reduced area of viable donor hair that reduces the overall number of grafts that you could get over X number of surgeries if you needed multiple surgeries. So the good news is it doesn't mean that you're going to go bald here. That's not something I've seen. But what it does mean is that this hair, it's thin now and it's not going to thicken up with time. So you have, like, you could take some hair from here, but I wouldn't recommend it. I would recommend going only up into this area here where you can reduce the density. We're assuming that you want FUE, by the way, where we would reduce the density to be more in line with what we have here. You don't want to thin this out too much because you already have this natural appearance of retrograde alopecia, which is found in a lot of guys, so it doesn't stand out as being unusual. But if you can reduce the density a little bit to better blend with this, then you have more of a donor homogenization to where it doesn't look like the numbers are that vastly different. But then it's interesting when we turn to the back. This tells me a lot. And this is also something I see in a lot of patients that have retrograde alopecia on the bilateral donor area. The occipital donor area, it looks really full. It looks really thick. But a lot of clinics would say, wow, this looks great. We can still get a lot of donor hair, but not so fast. The problem with your kind of hair and your donor issues is that the density is maybe not as high as what a lot of people would think. Now, we have to look at the typical characteristics of different kinds of donor hair or different kinds of hair on different kinds of scalps. And when you look at people with fair skin and blonder or lighter colored hair, that hair is usually more dense than darker hair that's more coarse. And the benefit for coarse hair is that the hair shaft itself is thicker in diameter, so you get more coverage on a one-to-one ratio of hairs, not bundles of hair, but individual strands of hair. You get better coverage. But coarse hair also has a lower density usually than finer hair. So you've got two things working against you, one thing working for you. The two things working against you is you probably have lower density than what this picture would indicate. And you have fewer hairs per bundle, so you don't have a lot of 4-hair bundles, maybe even not a lot of 3-hair bundles, as compared to someone that has finer hair and lighter colored hair. So those are two things working against you. What's working for you is the hair is more coarse, so you do get coverage on a hair-to-hair ratio. But the other reason why I think that your donor hair looks so full is because your hair probably grows out at more of a right angle from the plane of the scalp. Most hair grows down on the back and sides of the scalp, but sometimes people's hair will be kind of sticking out a little bit more than it should. And so when you have a bunch of hair in this area, it makes it look fuller, especially with this length. It's not really short. It's not long, but it's not really short. So my overall impression is that you have a good donor area, just maybe not as good as some people may have told you. So combine that with the retrograde alopecia on the bilateral donor zone. It's not that you're not a candidate, it's just you're not a great candidate. So the question now is, were the graft estimates that you got from the clinic in Turkey that you're talking to, are they sufficient to meet your goals? Well, if we're going to look at your original goal of a full head of hair, no, it's not going to meet your goals, and I've already told you why. But the numbers that you were quoted, I think are reasonable, but could be lower. And the reason being is because when we look at your the frontal zone, they said 2,200 to 2,500 grafts for the frontal zone. But what are we working with here? You got the forelock, which is still got a pretty good density, and you got the channels on this side and then this side that are weaker, and then of course that area behind those talking about, which is weaker, which makes this forelock isolated or almost isolated. So it's a isolated frontal forelock. So the forelock itself maybe could use some work, but certainly the areas around it to fill in those gaps and to rejoin that with the rest of the scalp. But as we go through the top, the anterior to the vertex, it's a narrow field of view. So I don't know what they're talking about when they say the front will have 22 to 2,500 grafts and then the vertex will have 1,500 to 1,800 grafts. The front could be everything anterior of the vertex itself. If that's the case, then I think that, yeah, 2,200 to 2,500 grafts is probably a good number. That will give you strong coverage in the midsection. But then when we go into the vertex, they're saying up to 1,800 grafts. Yeah, I think that's fair as well. You could get away with less, but I don't think that you would be happy with less, and I'm not even sure you'd be happy with the estimate that they gave you. So here's my recommendation. First and foremost, stick with the medications. Do not change anything. Don't subtract anything. Don't add anything. You said that it reversed things, at least to a small degree. So stick with that. That's where you want, like, it's establish your baseline, you're solid. Don't change anything. But the second thing is, you know, if you have to have surgery, if you have to move forward, again, I got to reiterate, you're not going to have a full head of hair. It's just not going to happen. You don't have enough hair to reach a proper density, and even if you were to get 50 grafts per square centimeter from front to back, it doesn't usually work out to where that makes sense, because the whorl pattern of your crown is a different pattern than what you'll have in the mid-scalp and the front. So density isn't always the answer. It has to do with the number of hairs per graft. It has to do with the distribution. It has to do with the design of the placement. So don't look at this from a numbers point of view strictly. Don't try to make this a binary issue, black and white. It doesn't work like that. So, but again, if you're going to move forward with surgery, I think that you should expect to need a second, maybe a third surgery down the road. And I'm not even talking about from continued hair loss. I think to get something that you would be happy with will take more than one surgery. I could be wrong, but I'm probably not. And I say this because I want you to really consider seriously what you're about to get yourself into. Because if this doesn't work out for you, you can't just start shaving your head and expect to make it look like nothing's happened. I mean, you think that having stubble is a bad look for a clean shaven head. Wait till, you know, those stubbles are interspersed with a bunch of little white dots that show that you've had an FUE surgery. So that's my recommendation. Really think long and hard about this, because you're not going to get what you want. If you shave or if you go with surgery, you're not going to get what you want. If you do come to the conclusion that you'd like to just have more hair, then I think that the recommendation that was sent to you, I think that's a fair recommendation. There's nothing wrong with going for a smaller number of grafts and just going on top of that, and maybe adding some Dermatch or Topic or some sort of topical filler that makes your hair look thicker artificially. It looks really good if it's done right, especially for cases like yours where it's diffuse loss. So yeah, I mean, that's my input on this. I wish I could give you a better, more optimistic answer, but because of your situation, but more importantly, because of your expectations, I don't think that you're a great candidate. Could you have a nice result? Absolutely. But I think that your expectations need to be put into check as far as what's possible and obviously what's not possible. So that's it. That's my assessment for your case. Thank you for your patience and for waiting. But yeah, for those of you that are watching this and you'd like for me to evaluate your case, send it in. Go to hairtransplantmentor.com and fill out the contact form where you have to give your permission for me to use your case here on YouTube. I will block your face out if that's what you want. I'm doing it for this guy. I can do it for you. And you'll get my assessment of what your case is like and what you can expect. So if you thought this was valuable, click that like button. If you haven't subscribed, please subscribe. And of course, click the notification bell and all notifications to learn about when the next video will be uploaded. So thanks for watching and take care. Peace.